Hi, I'm Dr. Jesse Call and welcome to the Chiropractic Experience, where every week we're going to go over how chiropractic can help different needs and different injuries and pain that people have. This week we're going to talk about just generic low back pain. This is someone who's coming in with, they kind of got the pain that's in a strip right here. They don't have anything traveling down their leg. They've probably bent to lift something heavy and they felt like their back went out, or they were rotating, or they did a lot of heavy labor, and so now their back is sore. This is a very simple and straightforward case. Chiropractic has a lot of success in treating things like this. What will happen is when you come in with this, what we want to do is we want to rule out that you don't have something that's more serious. So generally in your first visit, what we do is we run just a couple of orthopedic tests to rule out, to make sure you don't have a bulging disc, or that you don't have fractures and things like that. So x-rays will take care of that usually. If there's need for that, x-rays can be taken care of. But today what we're going to do is we're going to show you just a couple of orthopedic tests that we do, and then we're going to show you how the adjustment works, and I'll explain how that works and how it gives benefit. Okay? So we're going to come on over here. So we're going to assume that my friend here has some low back pains. Okay? Well, one of the first things we're going to do is we're going to perform an orthopedic test. This is called Kemp's test. So what I'm going to have you do is I'm going to have you cross your arms over your chest just like this, okay? Now, she's got pain right through here. She's probably feeling it here, and what we want to do is I want to make sure that that pain doesn't travel down into her legs at all. So orthopedic tests are designed to be provocative, so what we're going to do is we would do it just to the point where she begins to feel the pain, and then we would back away. We don't want to sit and flare her up at all. So what we do is we come like this. I'm going to pin her down. We're going to rotate her to this way, and then come back and around. When we did this, she would get pain right here, but nothing would come down the leg, nothing would go into her butt, and we would do it on both sides because she's a whole person. Come back like this. Same thing to the other side. Okay. Now I'm going to have her lay face up. One of the next tests that would be very common that we do is called the straight leg test. This is a really good test to make sure that we don't have any pain going down the leg, that we don't have that disc bulge. Okay. And if she had the pain was sided, I would always do the opposite side first. We always try to do the side that doesn't have the problem. But in this situation, we're just going to check both sides. And we're going to bring the leg up. You're supposed to get to 90 degrees. Here, she can probably actually go farther, she's a dancer. But what we would do is, if she had back pain, she would feel it. If it was a disc, she would feel it down in here somewhere. She'd start to feel that pain come down her leg. And if it's just the joints in her back or the muscles, she'll feel it closer to the 90 degrees. And where she feel the pain. We would check that on both sides here, the same thing, all right? Once we've ruled out that you have something more major, we can go ahead and start the generic treatment. So I'm gonna have her flip onto her tummy here. Not the generic, start the treatment. And what we'll do here is we want to see, we do a chiropractic exam. We're just going to check her to see where she's got restrictions, where those muscles have taken the joints and misaligned them and taken them out. And they're not getting the motion that they need, and that's part of the reason that the pain is happening. So we find that. We're going to check that. A lot of times our feet can tell us tons of things. This is related to our pelvis. We're looking for the side that's shorter, that tells us that the pelvis is rocked out of place and actually pulled her leg up, making one shorter than the other, which can also contribute to the pain. She's got a leg that's short on the left, so I'm gonna have her lay on her side, facing me here. Go ahead, we set them up. It's a simple setup. Take her here, and then we go ahead and we make the adjustment. Really simple, feels great. When you've got that stiff, tight back, what we want to do is we want to set that, and then we go do some therapy, and we'll cover that in a future video. But thanks for watching. We'll catch you next time.